Self-harm impacts almost a third of teens and young adults. Self-harm can be difficult to notice in a loved one, and often feelings of shame make it harder for someone to talk about it. People who self-harm are deserving of care and compassion. This video shares the signs of self-harm in young people and gives advice on what loved ones and peers can do to help. Hi, I'm Dr. David Goldblum. I'm a psychiatrist, and I'm here at CAMH, also known as the Centre for Addiction and Mental Health, which is Canada's largest mental health and substance use teaching hospital. In this series, we're exploring the top mental health questions on the internet, so make sure to subscribe to our channel and turn on the notification bell to stay informed. Self-harm is when you injure your own body on purpose. Often, self-harm in teens and young adults looks like cutting themselves, preventing wounds from healing, headbanging, biting, scratching, hitting, taking too much of a drug or a harmful substance, or burning. Often people self-harm multiple times in a single episode or day, and the injuries are usually on a body part that is easy to hide, like the forearms or the front of the thighs. Self-harm is complex and not caused by one particular thing. Teens and young adults are at particularly high risk of self-harm, partly because of the time spent on social media, with almost 92% of teens saying they use social media daily and 24% saying they are online almost constantly. Research shows that a lot of time spent on social media, such as Instagram or TikTok, is connected to higher rates of self-harm. Unfortunately, even after people get mental health treatment for self-harm, they have a higher risk of relapsing after going back on social media. Researchers also talk about something they call social contagion, when two or more people from the same friend group self-harm in the same way. This can happen when someone sees a friend or a peer, either in person or online, self-harming to deal with difficult emotions. Teens report self-harming to feel relief from feelings or thoughts, to punish themselves, to get attention that they need, or to deal with feelings of wanting to die. Other reasons include a way to deal with relationship challenges, a call for help, to communicate feelings, to avoid acting on other urges, or to end a feeling of numbness or feeling nothing at all. First, research shows that teens are much more likely to talk to their friends and peers instead of asking for help from mental health or other medical professionals. Keep in mind that someone who self-harms might be feeling fear, shame, embarrassment, and other social pressures. They may also think of self-harm as a positive thing or an addiction. So as a friend, family member, or peer, if someone shares with us about self-harming, the way that we respond is so important. In those moments, try to be as calm and non-judgmental as possible. If you have a strong or negative response, that person who's struggling may not feel safe reaching out again. There is hope. Self-harm is treatable. So if someone reaches out to you about self-harming, be supportive and gently encourage a conversation with a mental health professional. Please visit the resources in the description. Recently, the creation of a new Canada-wide crisis line, 988, provides free support for anyone who is thinking about suicide, in emotional distress, experiencing self-harm, or who is worried about someone they know. I'm Dr. David Goldblum. Did you like this video? Subscribe to our channel for more evidence-based insights on mental health and substance use.